this is a draft of the lecture, Medical Legal Issues for Scribes. Probably a better name for it would be How to Keep Your Doctor and Yourself Out of Court. So, why are we subjecting you to this presentation? It stems from a recent survey we did of the physicians that identified medical legal issues as one of the physicians' biggest concerns about the Scribe program. There are two things you should know about this concern of the physicians. First, medical legal issues are one of the physicians' biggest areas of concern about all aspects of medicine, not just scribes. And secondly, this is not your fault. This is the lawyer's fault, and it's the universe's fault. What I mean by this is that bad stuff happens. No matter how good your doctor is, some of their patients are going to die. Some people that they send home, it's going to turn out they were very ill, and they're going to do badly. And some people that they treat are going to wind up with permanent disability or disfigurement from their disease or injury. When these things happen, such as this heart attack, they are often construed by the patient or their surviving family as the fault of the physician or the hospital that treated them. This, of course, is justified if the doctor has done something wrong, committed a mistake. However, most of the time, these bad outcomes are simply the best we can do with medicine in its current state. So, unfortunately, a lawsuit against a doctor who provided flawless care can be successful if that care is not well documented. And this is where you come in as our documentation experts. Okay. Your documentation can be all that stand between your good doctor and our lawyer friend here. Okay? So let's outline exactly what we're going to do today. First, we're going to talk about what malpractice is and what it has to do with the chart that you are writing. Secondly, we're going to talk about how a doctor thinks and how you can think like a doctor. Because only by understanding how the doctor's thinking can you document their thought process. Thirdly, we're going to talk about specifically how a doctor thinks through certain high-risk chief complaints. When I say high-risk chief complaint, I mean one that a lot of malpractice stems from, or one that if malpractice stems from, it's very expensive. And thirdly, I'm just going to talk to you about some miscellaneous tips that can help you keep yourself and your doc out of court. So let's start with malpractice in the chart. So, a lawsuit is to a certain extent a game. The proceedings will not give your doctor the benefit of the doubt. If you hypothetically had two identical visits to the ER, one could result in a successful lawsuit, and the other never even been considered for a lawsuit if the first one had good documentation and the second one had poor documentation. We want you to better understand how that documentation indicates to a lawyer how the doctor ruled out serious disease. So with no further ado, I first want you to remember the chart has three audiences. In training so far, we've really emphasized that first audience. That's the coders who get you and me and everyone paid and make the money for the company. And you're very good at getting all your HPI elements and making sure you've documented the right number of physical elements and EKGs are all there and so forth. So we have no concerns about that. The second audience is other doctors, because when these patients get admitted or go for follow-up, another doctor might look at this chart. But you know from your own experience that writing for another doctor is really easy. What do you do when you get a patient's old medical record? You look maybe for the past medical history, maybe the diagnosis they had, maybe some lab values, but you don't read that whole rigmarole narrative, okay? So basically, if your diagnosis is on, you've satisfied the other doctors. Okay? Then there's that third audience, the lawyers. Okay? 1 in 15,000 charts is going to get in front of a lawyer. Okay? Because something bad happened, family decided, we think somebody did something wrong, and we want some compensation for that. So, how many of those 1 in 15,000 charts will actually go to court is going to be entirely dependent on how well the doctor's thought process was documented, and of course how good that thought process was. Remember, in a lawyer's thinking, if it's not on the chart, it didn't happen. And that's legal thinking as well. If it's not documented, there's no reason to think that it happened. Okay? So what's the definition of malpractice? So malpractice is professional negligence by act or omission by a healthcare provider in which a care provided deviates from accepted standards of practice in the medical community. Forget it. That's boring. Let's just get rid of a bunch of this stuff, or else we're all going to be asleep. Okay? And get to the essence here. Oops, my mouse moved. Sorry. Okay, so I think a pared down definition is simply an act or omission by a healthcare provider, which is your doctor, which causes injury or death to the patient. Okay? But we can pare this down a little further. Okay? Because really, the lawyers take care of this whole second part, this injury or death to the patient. You're not going to hear from a lawyer unless that's already happened. So we don't need to worry about that. The lawyers will let us know that will happen. And so really we're just left with acts or omissions leading to this injury or death. And good thing for you, for the most part, it's going to be the doctors that commit the acts. Okay? You're not really making the decisions or giving the drug. It's going to be the doctor who gives the wrong drug or the wrong dose, or does the procedure badly, or gives the wrong diagnosis. That's not you. Really, the only act you can do that's going to result in malpractice, so that's the doctor. The only act you can do is mix up patients. If you say to your doctor, oh, the patient 19 is still in pain, and your doctor gives them extra medication, but it turns out they switched to patients, and then this patient at 19 is overdosed. Or if you document the wrong stuff on the chart, or otherwise mix up names in a way that could hurt a patient, of course, you could actually be responsible for an act. But I think apart from that, acts are not really your issue. So the second part of the definition, the omissions. And that's it. For a scribe, malpractice means omissions. Okay? I'm actually going to erase this out of the presentation. And avoiding omissions becomes a team sport between you and your doc. It's the doctor's responsibility to do and think about everything that's indicated to take care of the patient. However, it's your responsibility to document all of that. From the lawyer's perspective, remember, if it's not documented, it has never been done. The tricky part for you is that the doctor's not going to articulate everything that they think about. For example, in every chest pain case you've ever seen with your doctor, they have thought about aortic dissection, pulmonary embolism, pneumothorax, esophageal rupture. But have you ever heard your doctor actually articulate that they thought about these things? I would guess no. And certainly not on the vast majority of your patients. The trick for you is to convey to the lawyer that the doctors thought about these things, even though they never mentioned them, by understanding the doctor's thought process throughout the visit. So is this mind reading? Yes, in a way. But it's mind reading that's actually possible if you understand the thought process of your doctor. And the key to this is knowing how the doctor is thinking.